Over the past year, we have seen the transformation of life as we know it. From a life busy and full of people, to a barren, quiet place. The hardest felt symptom of this has been the inability to mix with other people physically. However, millions of people across the globe have been unable to attend, or deterred from GP and hospital appointments. In the UK alone, Cover magazine reported there were 24 million fewer GP appointments between March and April, due to government restrictions.
Please wash hands, cover face, make space.
This means that there is a shortfall between what GP service is offered by the NHS and what the public really need. In order to combat these problems, 3 Northern Irish students were asked 3 questions about the problems they've encountered with the NHS GP service. The choice to use students is due to them experiencing the problems to follow, both before and during the COVID-19 pandemic. The 5-stage design thinking model was used for this task.
Hi,
My name is
Alex, I'm 19 and I'm from Derry. I'm currently studying social policy in Ulster University in Belfast this year, so I'm away from home, but I do suffer from asthma.
I'm Christine. I'm a full-time law student in Ulster University in my final year of study. I'm 20 years old and I have epilepsy.
my name is Kaelan Tanner. I am 21 years old. I'm a business studies with marketing student at Ulster University, and I'm a type 1 diabetic.
As a student, I do live away during term time, so I'd have to re-register with a new GP near my campus, but obviously unregistering at the GP at home, and that can be quite time consuming and a bit of hassle as well.
So as a student, I do move around addresses a lot. I have one address in Derry, at the campus, and then I have my Irish address where I live most of the time when I'm not at college, which is in Cavan in the Republic of Ireland in the south, and then I have an address in England in Ascot as well. So I'm kind of like moved between the 3 because my parents work over there, and sometimes I go over for a holiday or whatever it might be. And when I move, when I move from address to address, I have to change GP each time, or I had to, because you have to re-register because a GP can only send the prescription within the county. So when I was in Derry, I was diagnosed with diabetes in Derry, and you have last December, the 6th, and you have to. So that's where they first set me up with the GP, which I already had there for being a student, and they set me up there, and that's where I got my prescription sent to a pharmacy there, and I go collect it. When I moved back to England, I had to change GP there, and then when I moved back to Ireland, then I had to, over the phone, change GP back to Derry so they could send it to the pharmacy in Derry, and then I would either get a friend to send it down to me or I'd go up and collect it. So it's just quite a tedious and annoying process that just didn't need to happen, until I found that I could get my prescription sent to me.
So due to COVID happening from last year on, I've found it well difficult getting appointments for my doctor's appointments, just in general about anything, just because I would have to book in advance and I wouldn't be able to get one straight away if there was a problem. Like if I had maybe a headache or something, or I was like not feeling the best or whatever, and I'd ring up, I'd have to wait a couple of days for an appointment rather than getting one that day, just because of COVID and all the rules, and it just holds appointments back.
With the pandemic going on, most GPs have resorted to on-the-day appointments, which means you have to phone on the day that you want an appointment, and you need to give a brief explanation of your symptoms or what's wrong, and then you leave a number, and then the next available doctor will phone you back, and then they will give you a time slot to come in and have the appointment. Most of these appointments don't happen until maybe 3 or 4 in the afternoon, which is really, really late, especially if it's an emergency appointment, which is quite inconvenient, and you can only make certain amount of appointments.
So COVID has just made GP service is kind of inaccessible. While I might have routine appointments that would change my, they'd advise like a change in whatever I was doing. They'd check up on me, see what my insulin dosage was, and adjust that. When before COVID, and then due to COVID, they've stopped all that, and they haven't even, not widespreadly. The NHS hasn't rolled that out over. They haven't rolled it out over for like FaceTime appointments, or virtual appointments, which is quite frustrating. Especially when you might need an appointment really quickly. Obviously, in an emergency, you could get an appointment or go to hospital, but the appointments that kind of prevent those emergencies are not happening at the moment. So COVID's just made it a lot worse, especially as a student where you might be like stuck at university and your regular GP might be back home. It's just quite frustrating that you don't have access to the usual essential services, well, that we would consider essential, are not accessible anymore, and it's been really frustrating not being able to get a GP appointment when you need it.
So just because I suffer with asthma, I have to get prescribed every 2 weeks, but it does cause a delay on my prescriptions. It could be 2 weeks, it could be 2 weeks and 5 days, it could be 3 weeks, so it's not really consistent.
Yes, I've experienced some difficulties with repeat prescriptions. Sometimes they can be delayed, they can be the wrong medication, it can come in the wrong quantity, or they can even go to the wrong pharmacy. So then I would have to deal with having maybe one less of a medication that I needed for the day, which wouldn't be good for my epileptic attacks. And I think having an online service would really help with these issues, because it eliminates another person with the whole transaction, and having some medication having similar names, it complicates things, and the other person on the other side can sometimes order the wrong prescription for me. So I think having this service will really help with a lot of people who have a lot of medication to order.
Getting my repeat prescription was and is one of the most frustrating things for me. When I moved back to England, I had to change over GP, which meant changing over I had to change GP in order to get my prescription over in England, because the pharmacy I was with, or the GP I was with, no, the pharmacy will not send my prescription to England. So I would have had to get someone to collect it for me and send it over. And then when I moved back to Derry after the first lockdown, I had to re-register with the GP there in order to get my prescription back in Northern Ireland, which just was a really tedious process, and it involved a lot of paperwork. And it's quite annoying because there was quite a long delay in between changing over GPs both times, when I had to use the prescription I had, which meant reusing needles sometimes. I had enough insulin, but it also meant like not having the blood sugar monitor, that the Freestyle Libre, which is the constant glucose monitor which goes in your arm, which you can just scan with your phone. If you don't do that, you have to prick your fingers every time you need to check your blood sugar, which is quite a lot of times a day, which is both sore and bad for your fingers, and just annoying when you're used to having the Freestyle Libre. And it's just been quite a really tedious, difficult time of every time that you have a delay with your prescription, because it ultimately affects your healthcare and your well-being, and your treatment of your disease. And it's just been like really difficult, not like having to reuse needles sometimes, because it's quite dangerous, because there could be blood on the end of the needle, and it is also like you have to take it out of the sharps box, which is kind of dangerous already, because you don't have the plastic coating on it all the time, that protects you when you take it out, a new needle out of the packet, that protects you from pricking your finger. So sometimes it is quite difficult.
By empathizing with the students, 4 major problem areas have been identified. These are the bureaucracy of the changing GPs, lack of integration between GPs and pharmacies, difficulty in finding short-term appointments, and insufficient medication prescribed.
Therefore, the problem statement is that when moving between home and student addresses, students with chronic illnesses find it difficult to access GP and prescription services. They often need to change GPs through a lengthy process, struggle to get appointments at short notice, and find delays in receiving their repeat prescriptions. GPs are restricted in the services they provide and do not have access to the technology needed to streamline their services, which is a major problem. Therefore, this proposal is for a mobile application that allows GPs to offer virtual appointments, make GP services compatible with smartphones, and create a data bank and patient data that can be easily sent to other GPs. So, what is the solution? The solution proposed is to create a mobile app that will allow patients to connect with their GPs and access the services required. Some such apps already exist, which include the features to follow, but the distinguishing element of this app will be the patient database that will allow patients to share their medical information with other GPs when and if they choose to change, eliminating the need for bureaucratic paperwork. In order to do this, multiple government organisations will need to be consulted, such as the CQC and Public Health Agency, and the all-important General Data Protection Rules outlined here in the Caldecott Principles. And following analysis of the problems outlined, approval from various government agencies and partnering with app developers, the next step will be to create an early-stage prototype.